of the most valuable things I get to do as a healthcare provider is not only help patients get to the point where they're expecting and have successfully conceived or have a positive clinical pregnancy, but to finish that journey and to make it to the live birth. And this is something that many patients struggle with. So we're talking about recurrent pregnancy loss and threatened miscarriages, which is often a very silent conversation, something that's not, I think, as openly discussed as it really should be, because I want to share with you today a very important groundbreaking study published in Malaysia that looked at a very important therapeutic option that's been shown to help multiple subpopulations of patients that struggle to make it to that point of a live birth. And so there's so many things to discuss, first of all, when it comes to helping carry to a live birth and reducing miscarriage risk. We see from an evidence-based perspective, there's so much to do in the preconception phase, looking at sperm health, the reproductive microbiome. And today what I want to chat with you about is the use of progesterone, a reproductive hormone, a sex hormone, and how its different applications for various subpopulations and patients that struggle to make it to the live birth stage may actually make a huge impact for them. So more importantly, this review published in Malaysia looked at a very large portion of the data available so far, published until recently, on the use of progesterone to help patients carry to term. So a very important group of patients that we need to help and try to help are patients who have what's called recurrent pregnancy loss, which, depending on the country and part of the world, some people define as 2 consecutive pregnancy losses. Some countries define it as 3 recurrent pregnancy losses. And having recurrent pregnancy loss, we see that using progesterone for patients who've had 3 or more miscarriages, there's a significant improvement in chances of carrying to a live birth, reducing the risk of a miscarriage, particularly for patients who've had recurrent miscarriages and present with spotting or bleeding during the early first trimester or into the first trimester. And we see, depending on the number of miscarriages that patient has had, the more miscarriages in the past, the more likely they are to benefit from using something like progesterone, and the greater risk reduction they would see in reduced chances of miscarriage. So this is a very important therapeutic to discuss, and there's a lot more to discuss about it. What kind of progesterone seems to be best? What route of administration? Are we talking suppositories, oral, topical? So this is something to speak with your healthcare provider in detail. And we also see for patients that have had a history of recurrent pregnancy loss, it may actually be a very good idea to start the progesterone in the luteal phase. So before you even know you're pregnant, and continuing it into the first trimester, as opposed to starting it just when you find out you've already successfully conceived and had your ultrasound. They see that the earlier intervention may actually be better. A second group of patients that we see can benefit significantly from using progesterone are patients who have what's called a short cervix, which medically, in this review paper published in Malaysia, was defined as a cervix with a length less than 25 millimeters. So this group of patients, or this part of the population, is unfortunately at a much higher risk of preterm labor. And there's fairly good evidence now suggesting the use of progesterone for these patients may help to greatly reduce their risk of having a preterm labor and may help to extend that pregnancy so they can carry to term. And so this review paper actually recommended, regardless of if patients have had a miscarriage or preterm labor in the past, if they have a short cervix, they should be considering their healthcare provider should be discussing the use of progesterone for them during their pregnancy. And the third group we see that may benefit from the use of progesterone is a group of patients that present with something called threatened miscarriage. So this is where if there's a condition, symptoms such as bleeding, spotting, something you pick up on the ultrasound that shows this may not be a viable pregnancy, unfortunately. This group of patients, even if they haven't had a miscarriage in the past, it appears that specific types of progesterone may actually be beneficial in helping to reduce their miscarriage risk, and again, helping them carry to a live birth. But it's very important to discuss the minute and the important specifics and details about this with your healthcare provider, because again, there's so many types of progesterone available, different doses. So we really have to use that evidence-based perspective to see what progesterone seems to really help patients in that specific scenario when there's a threatened miscarriage but no history of a recurrent pregnancy loss. So this is where we are so far in the research, and this is by no means written in stone. There's always more research coming out, and we have to, as healthcare providers, look at this research and share this important information with our patients so we can help them make informed decisions and educated decisions, and help them feel empowered that there's actually something that can be done if you're having difficulty carrying to term, and it's not just a watch and see game. And this is like the part that I, as a healthcare provider, often find frustrating, is that when patients come in and they feel like they're kind of on their own after they get pregnant. There's like a lot of support for them, or a lot of patients feel like they have more support up until the point where they have that positive pregnancy test, but then they're waiting weeks and sometimes into the second trimester before they even have their first appointment with a healthcare provider. So it's very important, and something that I definitely strive to do for all of our patients is to help them right through that important and critical journey and stage of that early trimester, because intervention at early stage may help you to carry to term and finally put an end to this whole fertility chapter of your journey in life.